Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Hamilton Depression Rating Scale assesses the severity of depressive symptoms in patients diagnosed with major depressive disorder and other mood disorders. It evaluates core symptoms such as mood, guilt, suicidal ideation, sleep disturbances, anxiety, and somatic complaints. The scale consists of multiple items rated by a clinician based on a structured interview. Its main purpose is to quantify the intensity of depression to guide treatment decisions and monitor therapeutic response over time. The tool is widely used in clinical practice and research to provide an objective measure of depression severity. The Hamilton Depression Rating Scale is primarily indicated for adult patients diagnosed with major depressive disorder. It is most useful in clinical settings where the severity of depressive symptoms requires systematic assessment. The scale assists clinicians in monitoring treatment response over time and supports medication management decisions. It is widely applied in psychiatric outpatient clinics, inpatient wards, and research trials involving antidepressant efficacy. The tool is less appropriate for pediatric populations or patients with bipolar disorder unless depressive episodes predominate. Its structured format enables standardized symptom quantification, facilitating both clinical evaluation and comparative studies. The Hamilton Depression Rating Scale consists of 17 items assessing the severity of depressive symptoms. The clinician administers the scale through a structured interview, focusing on mood, guilt, suicide ideation, sleep disturbances, anxiety, somatic symptoms, and weight loss. Questions vary between multiple choice and severity ratings, each with specific scoring guidelines ranging from 0 to 4 or 0 to 2, depending on the item. Responses are based on symptoms experienced over the past week. Each item score is summed to produce a total score reflecting depression severity. Scores from 0 to 7 indicate normal or no depression, 8 to 13 suggest mild depression, 14 to 18 denote moderate depression, 19 to 22 implies severe depression, and scores above 22 represent very severe depression. The scale requires clinical training to ensure accurate symptom assessment and scoring consistency. The Hamilton Depression Rating Scale demonstrates variable sensitivity and specificity depending on the clinical context and cutoff scores used. Sensitivity refers to the scale's ability to correctly identify patients with depression, indicating how well it detects true positive cases. Specificity refers to the ability to correctly identify individuals without depression, reflecting true negative detection. Studies report the Hamilton Depression Rating Scale sensitivity ranging from approximately 75% to 90% when identifying major depressive episodes, meaning it correctly identifies 75 to 90 out of 100 patients with depression. Specificity values often range from 65% to 85%, indicating that 65 to 85 out of 100 non-depressed individuals are accurately classified as not depressed. For example, using a cutoff score of 17 on the scale, patients scoring above this threshold are likely to be correctly diagnosed with depression, high sensitivity, while some false positives may occur if specificity is lower. These metrics highlight the scale's utility in clinical settings for screening and severity assessment, but also the necessity of complementary clinical evaluation. Developed by Max Hamilton in 1960, the Hamilton Depression Rating Scale was initially designed to quantify the severity of depressive symptoms in patients already diagnosed with major depressive disorder. Validation studies conducting psychometric analyses consistently demonstrated high internal consistency, with Cronbach's alpha coefficients frequently reported above 0.8, indicating reliable inter-item correlations. test-retest reliability assessments showed stability of scores over short intervals, with correlation coefficients ranging from 0.7 to 0.9. Construct validity has been supported through significant correlations with other established depression rating scales, such as the Beck Depression Inventory, with correlation coefficients often exceeding 0.7. The scale's sensitivity to change has been evidenced by its widespread use in clinical trials, where it effectively tracks symptom improvement following pharmacological interventions, thus establishing its criterion validity. Furthermore, factor analyses performed in diverse populations have confirmed the scale's multidimensional structure, capturing core affective, somatic, and cognitive features of depression. These validations extend across varied demographic and clinical settings, contributing to its acceptance as a standard tool in both research and clinical practice. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.